Welcome to the Flint Community Webinar on Coronavirus. We are now in week 98, and this webinar is brought to you by the Healthy Flint Research Coordinating Center, the Flint Center for Health Equity Solutions, and the Michigan Prevention Research Center. We are so thankful, and I say thankful with intention that you joined us today, because there's a lot going on, but we really do appreciate those of you that participate every week to help us not only bring a local context to the global pandemic, but to share this information with other community members who may not be able to be with us today. I'm your host, Javon Lewis, co-director of the Healthy Flint Research Coordinating Center, and we look forward to your participation today. Want to tell you right up front, as we look at these partners that have joined us for these 98 weeks, that there are more partners that will be joining us. We'll be hearing from them in the weeks to come, so please be mindful of this and keep us locked into your schedule. Today, we'll have with us representatives from the Genesee Health Plan, the City of Flint, Dr. Reynolds is here, the Hurley Medical Center, the Greater Flint Health Coalition. We also have representatives from Michigan State University, University of Michigan, Flint, and our list goes on. So please, please, please put your questions in so that our participants, our panelists, will be able to answer them for you. As we prepare for our roundtable today, I want to ask you, as you're listening, we've had a lot of language changes in the last few weeks, actually 98 weeks. So I'm going to ask you, if you've had some terms that have come up that you've learned during COVID, I just want you to put them in the Q&A or put them so we can see those terms. We're going to talk about understanding COVID terminology a little bit today. We're also going to talk about COVID and taxes, strengthening economic support. And we'll hear about more from about our equity brief, because we are really trying to make sure that we consider the health equity and health disparities and how we will address those. And then we'll, of course, hear from the Genesee County Health Department. Want to just let you know, representatives from the City of Flint who plan to be with us today, they are addressing another issue. So we want to yet appreciate the City of Flint for having representation to share with us what's going on in the city. And you can feel free to call the City of Flint at any time if you need information about the activities going on with the city. They want me to remind you that there are job openings available. So if you're interested in working for the City of Flint, please go on their website and get more information. Now, let me welcome our roundtable team today. Roundtable team, that is a nurse. We're going to hear Dr. Deborah Fairholden, Dr. Wolford, and Dr. Lawrence Reynolds. And I know Dr. Hacker following us short. I want to just I'm going to show this slide as we're looking, and maybe this would prompt some ideas from those of you that are participating. I'm going to put up some terms that we've seen for the last few weeks come forward, and just go back then to the roundtable and ask you, let's talk about these terms and just make sure our community understands. First of all, we had to understand what coronavirus was. I had not heard of it in this way before. COVID-19. Different from other SARS viruses, and we want to talk about that. We learned about social distancing, spike protein, monoclonal antibodies, long haul and long haulers, COVID test, endemic, epidemic, pandemic, and of course, mRNA. So let's go back to our tile of all of our panelists here, and let's just jump right in. Help us understand all of these terms. Dr. Reynolds, where do you want to start?
Well, coronavirus. There are other coronaviruses that cause the common cold, and we've all had them. And if you have not had them, maybe you were born on the moon. However, now we have a new coronavirus. That's why we call it novel, not like a book, but it's never been seen before. And that is the cause of the pandemic. And it's SARS-CoV-2, CoV-2, but that is the name of the virus. And COVID-19 is the name of the condition that we get from the virus, COVID-19 infection, all right? So The problem is that this virus has not been known to us. So it was one thing to learn about the first strain. It's another thing to learn about the second strain, or the variant of concern is what we call it. And we have several others that may be of less concern now. But here's the challenge. Every time we get a new variant that we're worried about and spreading, like Omicron, we're learning something new. And that would be like saying, just because so-and-so is my cousin, we're identical twins. That is not the case, okay? And that's the problem or the challenge with us for Omicron. It's more infectious. What is the spread? From one person can infect 6 to 10 people. So it spreads very quickly. But if you have twice as many people getting infected, that means twice as many people who may have problems requiring hospitalization or a significant problem will present for care. And that's why our hospitals are overflowing. And I'll stop there.
So you've given us another term in there that we can add to our list, and that is variant of concern, because Dr. Deborah has told us there, I don't know how many variants, Dr. Deborah, and why are some considered of more concern than others?
Great question. So we've got what are known as variants of interest or variants of concern. And the big two criteria for those, and this is really being led by the World Health Organization, are particular variants that seem to cause either more illness or and more severe outcomes, or more infection, i.e. they seem to be more transmissible or more infectious. And we've had variants of concern or variants of interest that just kind of petered out. The ones that we typically know about, like Delta or Omicron, are the ones that like stuck in the population. So they not only got identified, as the variant that caused either more illness and or more severe illness or seemed to spread more easily, but they also stuck around and lingered. And then with the case of Omicron and Delta specifically, I'm using those two examples because they're the recent ones that we all know, they became the dominant strains, being transmitted in our communities and really on a global scale.
So we're saying more people get sick from these ones that are of concern, so they're more easily identifiable. But also you said stick. Now, right now, for some of the other ones, they went away. But these two seem to be hanging in here, and Omicron really hasn't like kicked Delta out. It's still here.
Yeah, we actually have both happening, but in many communities, we do what's called genomic surveillance. So we are monitoring in communities to understand specifically what strains of the virus are most prevalent in communities. But I do believe in most communities, the scale have tipped and the lion's share of cases are Omicron cases. But in fact, we still do have cases of Delta in our community as well.
Thank you. So when we talked about these variants, this is one of the real wonderful pictures Dr. Wolford showed us about the spike protein, which helps us to see how those variants work. Can you review that for us again this morning or afternoon?
Sure. So the spike protein. So when we think about a virus, what a virus is if we think about, this is what I had on hand, an apple, say this is our virus. What it's made up of is made up of the outside surface, which has proteins all over it. In this case, we can think of this as the little tag here, little stem here, as the spike, okay? So it has these things on the outside. And you could look at that and know that you don't have an orange, you know you have an apple, because this looks like the kind of stem you'd see on an apple. On the inside of all of our viruses, we have seeds. These are the genetic material, right? So we have the genetic material in the inside, and then we have these proteins on the outside that can help us identify it. In the case of COVID, it has a very unique spike protein, And so that is what it has. It looks like a spike. That's just why we call it a spike. It's on the outside, and we can use it to identify it. So for our tests, when we're testing people to know if they have, COVID, the rapid test looks for proteins on the outside, because it doesn't just have the spike protein, it has other ones as well. So it looks like the skin on the outside, and the rapid ones tell us right away whether or not we have the outside of the apple. And then the PCR tests, those longer, the ones that take a little bit longer, those PCR tests, those look for the genetic material on the inside. They look for the seeds. They look on the inside to see if we actually really have COVID. One thing that we should mention is that our vaccines make our body know what this spike protein looks like. So our vaccines cause our bodies to make just the spike, not the whole virus, just the spike. And so our bodies then can recognize this spike when we come in contact with the whole virus. And the problem with the variants is that their spikes look a little bit different. So when you get a variant, your spike may not look exactly like the average apple stem. And so your body may have a little bit of a harder time recognizing it and fighting it off. But it isn't a whole different thing. It doesn't look like a pen. It looks like this, but not exactly the same, which makes it a little bit harder for our bodies to recognize it and fight it off, but not completely different, which is, praise the Lord, why the vaccines are still protecting us from severe illness and death, even though we have variants.
So you're talking about now severe illness and death. Give us an opportunity to talk to Nurse T, because she's working in the hospitals. And when people unfortunately get sick from COVID, the variants, Omicron or Delta, we're seeing more people in the hospitals. And you said the vaccine helps. So Nurse T, help us to understand why you're recommending the vaccines, and what do we see in the hospital as a result of non-vaccinated persons?
I recommend a vaccine because, as everybody has mentioned, it's a layer of protection, and it will help reduce the illness and improve your outcomes. A lot of the patients that's populating the ED and our inpatient beds is patients that already have underlying conditions. So if they have underlying conditions of diabetes, heart failure, CHF, or any of those diseases, it's exacerbating that. So it's like, almost in my mindset, the virus looks for a vulnerability and it attacks that. And so, like, one thing common with diabetes is, you know how the virus can cause you to lose your taste and smell. Well, if a diabetic has lost their taste and smell, and then they're not eating, and then they're not eating their proper nutrients. And so now that's just masking that illness.
So we really want to make sure these layers of protection, which we talked about, we're making sure that we do them. And this is one of Dr. Reynolds' wonderful, and Dr. Deb, they've done a good tag team on this, talking about those layers of protection, which is something new too, even though we knew they were there. We've talked about them a lot different during the COVID world experience. And that's where we get into, again, this whole endemic, pandemic, epidemic. And so I want to ask Dr. Hackert, with all of this, how are we doing now here in Genesee County? What do you say to us as a health officer?
Good morning, and I do apologize for racing in here. I am giving cautious optimism that we, like the state, the country, are seeing a decline now in our absolute numbers, and I'm hoping that we're on the other side of the curve, starting to go down. But as everyone has been talking about, our numbers are still dramatically high. So it's not at all a time to let guard down, or to take any kind of, not keep thinking about what precautions can I take. And so as everyone has said, the best thing is vaccination. What else can you do is wearing a well-fitted mask. If you can get access to the KN95s and the N95s that are being distributed now nationally, that would be great. We are going to be from the health department. We got a little bit, a small source of them, and we're going to be distributing those. I'm not sure if anyone said this already, but we are distributing those through our senior centers, and then also to protect the staff and teachers of our schools. But there are going to be ones, in the general population to be able to reach everyone. So it's those well-fitted masks. If you haven't had a chance to go get those, again, it's those surgical masks with a cloth mask over it that will hold the edge down and protect you. But we also want to keep on remembering that exercise is important to keep your own innate immunity up. Vitamin D levels, if you haven't had yours checked, if you don't have any idea what it is, next time you talk to your doctor, ask to get a lab order for that. And the hand washing precautions, while this is not thought to be transmitted at all really from surfaces, probably less than 1 in 1,000 cases are from surfaces or hand transmission. It still will transmit other things that then could be confused with this. So those are all the really important things that we just have to keep up remembering, because this is not the time to get even, the flu or a cold. It's time to keep all the protections up. But our numbers have gone down now for basically 3 weeks in a row, but they're still 10 times what high is.
Thank you, Dr. Hackard. And so you've given us, this team has given us some more terms that we want to think about. So I want to ask you again as participants, if there's some terms that you still have questions about or not quite clear to you, please put those questions in, those terms in the Q&A, so we can make sure that we address those in the next couple of weeks. Something that we talked about is those breakthrough cases. And I've never heard about breakthrough cases before. So we never, even when we get the flu and we get flu again, we don't call that a breakthrough case. I see your hand, Dr. Hackard.
So again, my apologies that I wasn't on here earlier, but did anyone talk about in vivo versus in vitro?
No, new terms for us today. So
so that's one of my personal favorites to kind of shoot down, because Dr. Fauci, who I do admire, he is just notorious for using those terms. And when people try and pin him down, I once heard him being asked like 3 or 4 times, what does that really mean? What does that really mean? Because he just could not get past the fact that he wanted to use those 2 terms. And when you'll really see those, so in vivo, like vivo being like vivacious, full of life, in vivo is actually in a person, or like in the well, this for COVID is in the person. So what happens with this virus in the person? Compared to in vitro, so you can think of like in vitro fertilization. Most people have heard of that term, and that's when you have infertility and you use lab sources. So in vitro is for labs, in vivo is how it's responding in your own body. So I think the important piece of that to remember when we're talking about variants is you will start to hear, oh, this variant is evading this vaccine, this variant is not responding to our monoclonal antibodies. And when these variants are very new, you may wonder, justifiably, what do they, how do they know if it's so new? And they're using in vitro. So they're using studies in the lab to see how it's responding. So when Delta first came out, they really thought by the lab studies, the in vitro studies, that we were going to not see a very good immune response to the vaccines. But we do know that the vaccines are effective with Delta, not as effective as they were originally, but they are a really good response if you're fully vaccinated. And so that's the difference. And so I just urge everyone to be a little cautious when you're starting to hear about new variants and whether they're going to escape the vaccines or whether they're going to respond to the medications we have, is to look and see, is that an in vitro study, which is their best understanding based on lab tests, or is that an in vivo study on people to see how we are really responding, because we all have different immune responses based on our general health as well.
Thank you, Dr. Hackett. And I'm going to go back to Dr. Reynolds, because Dr. Reynolds, you talk to us from time to time. You know, people are doing their own research. We've encouraged that. But there also is a deeper dive into research. I know you sent me a couple of articles and it's like, read this because it gets more into clarifying. So I just want you to touch on that a little bit for those who really are desirous to do their own research.
Okay, one of the challenges during this pandemic is the media, television, will report something. And it may be before there's an official announcement that has all the sources attached. And so many times you may hear some of us hold back until we see a credible source. And that could be the CDC, could be the FDA, the state of Michigan, Genesee County Health Department. And you'll find that sometimes there's not a complete resolution of a difference of opinion because they're looking at different aspects of a problem. So you will hear the FDA approved something because the benefits exceed the risks and it's safety. It's safe. But then you may also read a couple of days later, but the CDC has to weigh in on this because they want to look at effectiveness. And it's almost like the discussion about in the lab versus in the person. So you will see many times we hang back. So when someone says, well, I did my research, you really have to decipher the source. Is it an in-lab study? Is it an in-person study? Is it in a population study? What age group? What pre-existing conditions there are? How large was the group? Were the things in study A done in a similar fashion to things in study B? And what were the conditions? So, you know, when we say, when someone says, I've done my research, I will respond to that. Yeah, I've done my research and reading, but I have to talk to Dr. Hackett. I have to talk to Dr. Verholden, who's an epidemiologist who looks at populations. I have to talk to Dr. Wolford because of her specialty. And then we sit down and go through these things. And we also look at the accumulated information. And then the other part is, because this virus changes, what you may have known for certain 6 months ago may be slightly different or may be a lot different. So, you know, I'm impressed that people are reading and doing their research, but the other thing we have to consider is we have biases. And sometimes we look just for things that will back up our beliefs. And you may have heard me say before, science is not, the level of belief in science should be minimal. It's a continual process of learning more and more and modifying our conclusions. So what some people call research may be looking with one eye, with a narrow perspective, with near vision, and does not include the entire picture.
Thank you so much, Dr. Reynolds. And we're running out of time for a roundtable today, but I want to thank all of our panelists in the roundtable. And I know you have more to add to this discussion. So we'll come back to some of this, but the important thing is for us today is to be good consumers of the information. And as Dr. Reynolds said, we may have to check other sources. And that's one of the reasons why we bring this webinar. So you have the opportunity to talk to credible sources, people in our community that we know that's doing all the background work to help us really understand what's going on. So thank you so much to our panel for your contributions in this webinar today. So much has happened in the world of COVID. COVID has also affected our economic base. And so as we're looking for how we can strengthen our economic base, we have a wonderful opportunity here in our community with the Greater Flint Health Coalition to learn one way to do that. And so Nicole Smith Anderson is here with us today, who's a special projects director at the Greater Flint Health Coalition, to talk to us about one of the approaches to improving our economic base, which helps us improve our overall health and well-being. Nicole. Welcome.
Hello, everyone. Okay, I'm thinking we might have the wrong slide deck loaded up. Oh, no, we don't. It was just the page was different. Fantastic. So I am very happy to be here to talk about this program. So just to give everyone a little bit of background, this is a project that we have. It's a 3-year grant from the Office of Minority Health. And really what we're trying to do here is determine if the implementation of the Earned Income Tax Credit through outreach and education activities has some sort of impact on any sort of risk or protective factors related to ACEs. And so we really want to see, by increasing awareness, by increasing receipt, is that going to have some protective factors? Want to look at the next slide? So oftentimes when I explain this to people, they're like, what are you talking about? So let me break it down a little bit more. So the Earned Income Tax Credit is actually one of the best policy changes. It's evidence-based intervention that can improve health in 5 years or less. So generally speaking, if we're looking at this, if we can get folks to claim this credit, it's a really good indicator for moving them out of poverty. So it really helps eligible low to moderate income working people keep more money they earn by reducing the tax they own, providing a financial boost for their households based on their income and family size. And we consider the health benefits of it. A lot of those are very direct. So improved infant and maternal health, such as increased birth weight, reduced risk for death, and poor childhood health. So again, it doesn't seem initially when you think about it like, okay, a tax credit is going to improve my health, but it actually is really an important mechanism. If you want to move to the next slide, please. Thank you. So just kind of an overview of how we're approaching this and what we're doing to improve our community. So increasing awareness of the Earned Income Tax Credit. So we have been so fortunate to have the best partners. So Michigan United, Genesee Health Plan, the Registry, United Way. We are doing our best to push out as much information about this as possible. The billboards are actually up. I just saw them the other day, so that was super exciting. We've hosted focus groups. We've done mass mailings, lots of pamphlet and information distribution. We've also launched a website, eitc4genesee.org. I strongly encourage everyone to visit. There's tremendous amount of resources on it. We're very, very proud of how it turned out. When we talk about reducing financial stress for families, one of the things that we've been working hard to do in conjunction with the United Way of Genesee County is expand those opportunities for VITO, which is Volunteer Income Tax Assistance Program. So this is an opportunity for families, people that qualify to get their taxes done for free. So this is a great opportunity that we've been able to expand this year, which we're so happy about because COVID has been challenging in so many ways, just in terms of staffing and opportunities, but we've been very lucky with being able to identify lots of supports. And then we're also offering a variety of workshops on financial empowerment and tax prep throughout the year. So if you go on the website monthly, we will have a ton of different workshops available that anyone can register for free. And then also looking at how we're working to decrease risk factors for ACEs. Obviously, if we can get more folks to claim that EITC, ideally it's going to show a reduction in poverty and increase economic stability, but we're also doing a lot of education about adverse childhood experiences. So again, those are workshops that we're going to be having on a monthly basis as well. And our lovely friends at MSU are helping us to evaluate this project. Want to go to the next slide? So these are just some of our materials. So on the upper left-hand side, we had postcard mailing. So this went out to lots of folks in Genesee County. So hopefully you are one of them. Also some samples of our workshops. And then we do have materials in both Spanish and English, and we have some Arabic options as well. Next slide. So this is just kind of a screenshot of the website. Again, I encourage everyone to go on and visit. We have lots of resources. Easiest way to sign up for workshops is via the website, and you can also kind of sign up just to stay connected, generally speaking. What's also nice about the website is there is a section all about free tax prep, and it has the list of all the 2022 VITA services. So if you want to go on and see where we're doing those free VITA prep, that's the where to get it, is the eitc4genesee.org website. Next slide. And then finally, this is all perfect timing. So this has actually been our Earned Income Tax Credit Awareness Week. So all week we've had a variety of workshops available. And again, what's cool is all of these have been recorded and they will be uploaded on our website. So we definitely encourage everyone to check it out. But again, all these workshops are free, all this information is free, and we really just want to encourage folks to, if you're getting your taxes done and you're not sure if you qualify, ask the professional that you're working with or visit one of those VITA sites, and we'll make sure that if you are eligible that you receive the credit. So any other questions or information, you can message me or check out the website for more info.
Thank you, Nicole. And this is actually perfect timing because on the 24th, which was Monday, tax season opened up, right?
Yes, yes.
This is an opportunity for all of those, and especially in this time when there were so many additional resources provided financially for families.
Yep.
It's really important that they understand this.
Yes.
So you made that link to with health, because the World Health Organization defines health as more than the absence of disease, and that's a little piece of it. And
Yes.
so it links then to social determinants. So this is one of those determinants. So please check out the Greater Flint Health Coalition's website. Give us again, is there a phone number if people need to contact someone directly?
Absolutely. It's 810-232-2228. And you can actually ask for Robert Reed. He's our program manager. He's hosting a different webinar right now. Sorry, guys. So otherwise he would be here with us. So I'm kind of stepping in for him. But I will say, just another thing I like to share about the earned income tax credit is it is something that you can retro apply for. So we have a lot of folks who didn't know they qualified, had never applied for it. So you can go back 2 or 3 years and actually claim it. And so again, when you're working with a tax professional or even through those VITA services, they'll definitely support that if you do need to kind of go back in time a little bit and make sure you claim that.
Thank you so much,
Yeah,
Nicole.
thanks,
Great.
Yvonne.
Appreciate your presentation. So we talk about health. We want to make sure not only are we doing those things that one might think is external to our health, we want to make sure we do those things directly related to our health. And this is where the health department comes in to help us to understand what's going on in community as it relates to emergency preparedness. And with this is an emergency. So Sherelle, what's happening with our COVID activities this week?
Hello, everyone. I was trying to convey last week that our cases in ages 18 through 24, well, 0 through 17, 25 through 39, they're the highest in our county. And then you can see over to the left, they have the lowest vaccination rate. So I wanted to encourage parents to make sure that they're getting their vaccines and taking their children to get coverage against COVID-19. Next slide. In the past few weeks, we have seen declining volumes of individuals seeking COVID-19 vaccinations. And so we want to remind you that we do have our standing clinics every Tuesday, Wednesday, and Thursday. And this Monday, we have a pop-up clinic that will be held by Catholic Charities in HAP. And that will take place from 10 a.m. to 1:30 p.m. And Tuesday, again, we're always at Our Lady of Guadalupe from 12 to 2 p.m. and Wednesdays from Central Church of the Nazarene from 10 to 12, and Thursday, Shiloh Missionary Baptist Church from 3 to 6 p.m. So we do want to see you pick up that pace and come out and get your first, second, third doses, as well as your booster doses. And we also wanted to remind you to continue getting testing. Although we've seen cases decline in Genesee County, it's still important that we keep our testing up just to make sure that we aren't spreading the virus around. So you can visit any of these sites on the screen: Word of Life Church, Bethel United Methodist Church, Macedonia Baptist Church, the local Walgreens and Rite Aids, and Hamilton Community Health Network. The 3 churches to the left of the screen, they also offer vaccines as well. So if you can't make it to any of our sites, you can also visit those sites to get your vaccination. And just a reminder, if you know someone who is unable to access our website or can't get out of the house to visit our walk-in clinics, we have a number to call. That number is 810-344-4800, and we will come to the home and administer that COVID-19 vaccine.
Thank you so much, Shira. Can we go back to the sites for a moment? And I'm going to ask Dr. Hackett if she could join you and I just for a couple of minutes, because one of the things you talked about was getting tested and the importance of getting tested. So are there some other things at the, some processes at these sites that you would help us to be aware of? Because I know sometimes they have the little, I don't even know, the little icon, the code, the QR code that people can actually register when they get there if they haven't already registered. What are some of the other things that it's important for people to know when they go to these sites?
Well, most importantly, scheduling an appointment will get you in guaranteed versus doing a walk-in. The lines have been long lately. So if you visit our website at gchd.us, there are links connected to those sites where you can go online and schedule an appointment.
All right, so Dr. Hackett, real quickly, we talked a little bit earlier about the mRNA, the vaccines. Can you tell us a little bit about the booster and why? And well, let me just say this. What's the recommendation for getting a booster, particularly after you've had a COVID diagnosis?
So that has changed with this last variant, the Omicron variant. Prior to this, they were, basically saying you have enough immunity to kind of let things go along and maybe wait as short as 28 days, but up to like 3 months. But now the recommendation is to go ahead and get your booster shot as soon as you are no longer considered infectious, which would be 5 days or 10 days. And they do recommend getting that booster vaccine to prevent reinfection with it, because people are getting infected more than once, even with Omicron, which is almost mind-boggling in the fact that that can happen. So you're just recovering from one infection, and without that booster shot, you could still be recovering vulnerable and starting a whole new infection with the same variant. It doesn't happen all that often, but nonetheless, it will prevent, it will boost your immune system so you do not get sick strongly with it. I mean, it really just prevents the hospitalizations and deaths.
One other quick question that's come up, Dr. Hackett, because people are saying, well, if I've got the booster and my immune system goes down, is the vaccine causing my immune system to be reduced? So can you clarify that?
It's actually the opposite.
Okay.
So you are getting a boost to your immune system with the booster, thus the term, but they're just saying don't wait anymore. And the vaccines, that we have, and everyone's still working on something that will be able to respond better to all the different spike protein mutations. But right now, the ones that they have, if you have all three, if you have your 2 shots, full vaccines, and then the booster, it's still very effective, but it is still something that they're working on.
Thank you so much, Dr. Hackett. We appreciate
that. Not very clearly said, but nonetheless.
But as Dr. Reynolds always said,
they change it all the time.
And things do change. So it's important that we have this venue so we can get updated as we move forward. So,
so if other people are confused, it's not really too confusing to me, but it's hard to say it clearly. So basically it just comes down to, as soon as you've recovered enough with your symptoms and it's been at least 10 days, go ahead and get the booster. That is the safest thing to do. Probably a lot better soundbite.
Thank you. Thank you, Sherelle. Thank you, Dr. Hackett, for those insights from the Health Department. Now, of course, our resident epidemiologist, Dr. Deborah, we got couple questions for you too, as you come to share with us and give us these updates every day, every Friday. So Dr. Deborah, here we go again. Give us these numbers by race.
Yeah, so I like to talk about the news, not the good news or the bad news, just the news. So the news is that in the city of Flint, we saw a decrease in COVID cases for this dash at the half week data, and it looks like next week we're on track for a decrease also. So, by the end of the data report that the state does today, we will hopefully be able to say we've had 3 consecutive weeks of decline in Flint. In Genesee County, we saw just a tiny uptick in last week from 3,817 cases to 4,065. It's too early to say whether or not that's a significant change. And once those lag cases and other probable cases come in, it might be an overall decrease. So my point is, it looks like things are generally moving in the right direction. As far as the racial disparities gap, as far as we can tell, that gap remains closed, but we do have this ongoing problem with so many of the cases, the data coming in as unknown race. And when I contracted COVID, I got the chance to kind of take a sneak peek and see how my data looked. And it was there. I think we've got some issues, and it's not on our end. It's something's getting lost in translation between the person who's filling out the information, what's happening at the lab, and what's getting reported back. Up till now, our health department did the heavy lift of going back and backfilling that data. But as you can imagine, the real job now is to make sure we've got good mitigation strategies in place. So we continue to do some, kind of work in the background just to look and see, are those cases that are of unknown race, are they disproportionately in any particular municipality within Genesee County, et cetera? So, cautiously, I can say it looks like that racial disparities gap remains closed. And the good news is the cases are moving in the right direction for the last several weeks.
So while you're right there, Dr. Deborah, when we talk about reducing disparities, we also want to make sure that people have access, because access is one of the issues that creates the disparity. And so we have a question in the queue, and I know we don't have all the answers on this, but we talked about masks and the availability of masks. And so I'm just wondering if any of us on our panel right now, I know they're everywhere. I guess I know Myers is distributing masks, KN95.
Yep. So look, we've learned the hard way not to put up or share resources without first testing them out. So I will say I did a test this morning. I went on the GCHD, Genesee County Health Department coronavirus website, and there's a number that they list for the COVID hotline, which is 810-344-4800. And I called the number and said, if I'd like to get free masks, where can I get them? Specifically, masks for children. And it took, I was on hold for, I would say, maybe about 1 minute. And then this very pleasant woman came on and she said, well, for schools and for children, masks are being distributed through the schools. The health department is supporting that effort, et cetera. And she also shared that Meijer is giving out free masks. So then I called Meijer. And they told me to come on down and I could pick up the masks that I needed for me and my family. So in fact, community masks are available. If you have school children, you can get them from the school. If you are just, adult, they are doing free mask distribution through Meijer.
So, and then everybody signed up. We had that great sign up for the federal government, UPS, to send you masks.
And get your, and we did not distribute our COVID brief last week, but it will be on our website at fches.org, fches.org. You click on resources and all the briefs are there. And I'm on grandma duty, so I got my junior epidemiologist in training supporting me today. But not only is the federal government allowing 4 masks per household, which, bravo, it's a step in the right direction. I don't think it's equitable, right? Because 4 masks for a single person household is a little different than what 4 masks are going to do in a 5-person household. But get your 4 free masks, and that's at covidtest.gov. And also legislation has been approved where your,
You were saying masks? You mean tests?
Tests.
Yeah.
Tests. Yes. And now the insurance companies are now required to reimburse you for up to 8 COVID tests per month, at home tests. So there are many, many vehicles to help get tests and COVID tests into people's hands. at no or very limited cost to the consumer.
Okay, so we've got now mask. I want to stay on mask, and then and I'm glad you're still here, Dr. Hackers, because there's a question in the queue I want to make sure we get answered. We talked, and Dr. W, you did great examples of how to wear the mask. So now we're talking KN95, K94. These are all new terms. So what's the best mask and why have we moved from the surgical mask to KN95 recommendation?
I'll say one thing quick about that, and then Dr. Hacker can jump in. The two keys that I'm telling people with masks, because the notion that you have to have a KN95 or N95, I'm a little cautious to say that to people, because for people who can't get access or can't afford them, I don't want them to feel like they're now left out or won't be able to protect themselves. The two key features is fit and filtration. You need a mask that's very well fitted and that has multiple layers of filtration. The KN95, the N95 mask have that all baked in. If you don't have that, there are alternatives, but the two features are fit and filtration, well-fitting, multiple layers of filtration.
Thank you, Dr. Hacker.
You said it all. She really did say it all. And you'll hear people talking on different platforms saying that unless you do the fit testing, the KN95s or not N95s don't work. You know, they'll say, read the box, it doesn't work. It's just not true. And what they are, it is still very effective. One of the things that it does do is if you have that healthcare worker fit test where you do the whole mask and everything like that, it will decrease the potential. The highest potential if you're wearing that mask would be that 10% would get through. But if you're doing the fit testing, so you have the perfectly fitted to your face, then it is basically guaranteed to be less than 1% of anything is getting through. But remember, that is someone who's a healthcare worker who is in a very close face-to-face situation with, the person coughing. I mean, literally, you could be in their mouth, like working on that. So those things are true. However, it's not what is necessary for general use. I personally have been fit tested. Am I wearing my fit tested recommended masks? No, I'm wearing a regular, KN95 that has not been fit tested, because I know that if I seal it with my fingers to make sure, that the air is not getting in, and when I breathe, it sucks it in a little bit, I know it's fit tested well enough. And so that's the key.
Thank you, Dr. Hacker. A couple of questions about vaccines, going back to the vaccine conversation. For those, this is a question from Deborah Hardy. Those waiting first dose vaccines after having COVID, must they still wait 90 days before they get first dose? Okay, so we want to make sure we clear that.
They do not. That is not. You just have to wait your 10 days that you may be infectious.
Okay. So for whatever the case, booster or first or second dose, as soon as they get a clear diagnosis, wait 10 days and then get that next dose or get the booster. First,
right.
All right.
And you'll hear people say the 5 days because 5 days isolation, but in reality, there is still a potential. That's why you still wear the mask, the closely fitted mask, on days 6 through 10. So your immune system is still going to be just the same intactness at day 10 as it would be if you just got it as soon as you could on day 6. So day 10 is anytime after day 10.
All right. One last question from a participant. I had COVID testing on January 21st and have not received results for both tests. Is this the norm now that we're waiting longer again?
That would really depend on where you are getting your tests done. That's one of the reasons why I do really support the ones that are working in our community through with the state. So those are the ones that Sherelle had put up as our testing centers, the ones we put on there. Those are generally quicker, but some of the pharmacy testing or other places that are doing the testing, there have been reports of longer waits. Generally, it's not been that long though. I haven't heard that. That's
can I add one thing to that too? When the person says they've had both tests, If you are getting a rapid test, you should be getting those test results the same day. I can just tell you one of the things that happened is my daughter signed up. She gave her cell phone number and her email address. Her rapid test results actually were in her email and she missed it. So if you are getting a rapid test result, they are doing those tests on site. You know, they ask people not to hang around the testing site, right? Because you don't want people, especially if they're sick, hanging around unnecessarily. But rapid test results, you should be getting the same day. If you aren't getting them, just go back and double check all of your communication channels and make sure that you didn't miss a text message or an email with those results.
Yeah. Thanks for sharing that, Dr. Deb, because I do this when I go to, especially I use the community site because I think we've been blessed with them. We want to keep them. So I get both the PCR and the rapid. And you're right, the rapid, it was a little bit longer, like a half hour, but usually it's like within 15 minutes. But it was a little bit longer this time because it was quite a full day that day. But one does come on the phone and the other, the PCR, usually comes by your email. So I totally agree with you, Dr. Deb. Check both those sites and just be on the lookout. Do what you can to make sure you get that information for yourself and for your families, because knowing what's happening for yourself really helps your families and the community at large. So thank you so much, Dr. Deborah, and thank you, Dr. Hackard, and please continue to keep those questions in. Our panelists will answer them for you.
Dr. Wolford had one comment to add to us about the reusability of the mask, which I think is important.
Okay, Dr. Wolford.
Just to say really quickly, you cannot wash the KN95 masks to reuse them, but you can put them in a brown bag and let them sit there for 48 hours, and then they can be reused if they're not, visibly dirty. You can leave them, you can use them again.
So again, a brown bag, like a brown paper?
A brown paper bag, put it aside for 2 days, and then you can use it again. So you can recycle them rather than having to buy so many more. If you have your 4, you can recycle them that way.
But that's if you don't have makeup and food and stuff.
Yes, don't use a gunky one, but if it's not grungy, you can put it in a bag. There, Nurse T has the bag right there.
Oh, okay, all right.
And if it ever gets wet, the electrostatic charge that binds some of those particles is no longer there. So if you get caught in the rain, if you get in the shower with it on, the mask is no good.
All right, so now you all have given us a whole nother conversation. We need to have a whole session on just these masks, because that's important information. And stay tuned, we will do that. But today, thank you all. We want to hear from Mary Catherine about this health equity brief now. So Mary Catherine, what's the news for us today from the policy brief?
Yeah, so I'm really excited because if for any of you who watched the State of the State on Wednesday night, you would have heard Governor Whitmer proposing the restoration of the Earned Income Tax Credit. This wasn't just the first time that this has been, right? There was a summary document that was available to certain audience. So we knew this was coming, but it's really exciting to actually hear and now be able to see that plan and see her calling on the legislature to get this done this year. So just to give everyone a little bit of background, so the Michigan's legislature actually cut the state's earned income tax credit value in 2011, and then that reduced the EITC value from 20% to 6%, making a really big difference in the amount of money that families were getting back on their returns. So restoring this back up to 20% will provide a much larger refund to Michigan's working families. And so just to put that amount in perspective, we're talking about going from a $150 average credit that Michigan families and individuals received in 2019, all the way up to about an average of $500 back into the hands of families. So I also just really want to point out that Michigan is one of 29 states that actually has established its own earned income tax credit to supplement the federal credit. And I just also want to add that I'm really hopeful about this legislation making it through, because in December, we had a bipartisan bill in the Senate to actually increase the EITC to 30%. So yeah, once the legislature gets moving on this, I think we can see it go through pretty fast. So fingers crossed. The next thing I just want to mention today is a new bipartisan bill, or more recent bipartisan bill, that is asking physicians to complete courses on lead treatment and identification. And so it actually requires over, I think it's like an additional 100 hours of continuing education on identification and treatment in order for physicians and practicing in the state of Michigan to renew their medical license. So the courses actually have some required content on screening for lead poisoning, and then also the physiological and behavioral signs that of lead poisoning, so that they can diagnose children faster and then get them treatment. And it also would require extra training on referring children with elevated blood levels to the appropriate state agencies. And so this is, while there's been quite a bit of backlash in the medical community about this, it's so important for equity, as we know here in Flint and in Benton Harbor. So two important things this week we're adding to the list to keep an eye on.
Thank you so much, Mary Catherine. I appreciate that update. And for those of you, we always talk about how important our voices are. Let's encourage our legislators. We want to educate them on the impact of these things as we're learning them, so that we can improve the overall outcomes in our community. I really want to double back just real quickly. There is a question in the queue that I think is extremely important for all of us to hear the answer to. And Dr. Hackert, you're answering it in the background, but I would love for you to talk to us about positive home testing and where should those results be reported?
Okay, I am answering it there because I thought it'd be helpful to have it in writing. Your home test should have instructions. If you read the instructions on what it is, some tests have a QR code that you're supposed to show, put that in there. Some will say to call a different number or something. But if you don't have anything on your test kit that you have, what you want to do is send it to I'm writing it in here too, info@gchd.us. So info@gchd.us, and put into that your name, your address, your phone number, and your date of birth, and that it was positive, and that way we can get it recorded for you.
Thank you, Dr. Hackert. And again, thank you to all of you who are participating by sharing your questions, because your questions help us to be sure we're getting the information, responding to the information and the concerns that you have. So this is valuable to you. We want to be sure to take a little bit of time today and talk to our community health workers and social workers. Very, very important that you're in the webinar so you can get these contact hours. Make sure that you select the item that you want, whether it's community education units or contact hours, and fill in all that information so you can get the continuing education credits. I will say to you, for our community, this has really been interesting to other communities to see how a community venue can offer contact hours and continuing education units. So again, your involvement and your voice has elevated this so that we can make sure that this is a value for you in community. We also want to remind you that we're here every week and we're working on week 100. 100 weeks of this series, and actually almost 2 years now. In a few weeks, it'll be 2 years that we've dealt with this issue. We've come a long ways and we've made a lot of adjustments over time. So we're asking you to continue to like us on Facebook. That's www.facebook.com/HFRCC, and subscribe to our YouTube channel. This helps us to continue to get the information out, even beyond the sessions today. You may want to share it with others. Also, if you have any additional questions or you need any additional information, send us an email at info@hfrcc.org. Someone will be there to respond to that. And also, please call us at 810-835-2130. I know we say that number, and sometimes we're looking for you to call us and so we can respond, but contact us so that we can improve the work that we're doing and better respond to the community needs by responding to a global pandemic based upon what we need here in our local community. We thank you for joining us today, and we look forward to seeing you again next week at the Healthy Flint Research Coordinating Center's Flint Community Webinar on coronavirus. Thank you for joining us, and again, join us next week.